Swayam Prabha. Digital India. Educated India.
Yes. Okay, so we will go for the next one. Meso. Meso, right? Yeah. So many things will drop down from macro to meso only. Okay. So we can go from this side. Yeah. You have mic. You can also hold mic. First, these people here. Just
Poor hospital management, lack of inter-hospital coordination, limited resources, technology integration gaps.
of coordination we have to really see because if it is a private hospital, yeah.
Limited resources.
Very need more specific point. Yes. Stop. You can stop. Right.
Yes.
Your group?
Yes.
Stay. Okay. Next group. And on the point.
So in terms of vaccine, as we already told, training health workers. Next is cold chain integrity checks, which are seniors told in macro level, but we include it in miso. Third thing is rapid response team for adverse drug efforts investigation. Which you use often.
What do I show?
That's all.
Okay. What did my Okay. So even at micro level, you have hospitals have good cold chain storage facilities but if the drugs, vaccines are coming from the source to the hospital, if those infrastructures are not there, okay, because especially conditions like COVID, these things will be imported and um and the first point where they would land, and after that where it will go to some hubs, till that point it is a government responsibility, okay, especially for those. So if there is any roadblock in terms of temperature control there, so even if the hospital level, the micro level, we have good infrastructure, it would just fail if something has been tempered on the way or through this thing. That's why this thing we will see at macro, meso and micro level, right? Organ transplantation, yeah. Correct. Yeah, so green corridors, how to define green corridors, how to dedicate the resources, the whole green corridor infrastructure, if it is the availability of choppers, the medical choppers, all that will be macro level. Okay. Yes. Next group. Such a big group, huh? Yeah. About you.
Meso level, we can talk about adoption and local people managing that medicines or something. Preparation of the program for the.
What do you mean by local people adopt?
Our example was hypertensive drugs and all. So in that case, if it is a new drug which is coming to the market or something, from government policy perspective, they can tell the hospitals, but what is the main people having the like they are willing to take the medicine or not? Are they satisfied with the feedback loop also we can take that? Are they satisfied after 6 months after using the medicine or not?
See, in India setting, it's a doctor prescribes and patient has to follow, especially like hypertensive medicine. I don't see patients have any say that this medicine I recommend.
Yes, not a
And even patients, they don't take. So what is your point?
Literally, the point is like in hypertensive medicine cases, it often happens that we are purchasing the medicine as per the guideline. That's a course that need to be done. But it's very often it happens that patients are not that much aware that then after taking few doses, they may stop. So the stock piles up, and ultimately it gets expired. So in that case, the local people who are being prescribed the medicine, their follow-ups is very much important so that the wastage part is minimized and it will be utilized fully.
Follow, they don't need to carry. The purpose of the patient is going this patient will definitely take. Why patient take? Why for them?
And it's not that way. See, in hypertensive case, in this hypertensive national program, we have a card, hypertensive tracking card. So in that card, they used to come at after a definite time, suppose 1 week or means after 2 weeks. So after 2-3 follow-ups, they generally don't come. But we have indented
Allocated
medicines.
the cards. There should be some policy like to divert that is something else so that any leftover can.
Now, as such, at present, we don't have that policy. But what we do is that we keep on follow-upping those patients to the means in the field level, so that they come up and they take the medicine. That happens in dots also.
It has been a unique case, isn't it? For last 3 days, we have been discussing lack of resources. It's not reaching. It is another example. Now, you are giving you are following up patient. Please come take medicine. Please come take medicine. Yeah, that's interesting. That makes, things more complex, where you are facing the shortage also and where you have to disperse the medicines forcefully, come and, take your dues, which are there. Correct. But I would suggest that even if after that, if they are not coming, there should be policies. Wait till this month. If they are not coming, divert those medicines where it is actually required. Right? Those kind of policies should be there. It's as good as, your ration things, So if ration is dispersed, somewhere it is just lying up and getting rotten and somewhere it is shortage. So such policies should be developed. Correct. Right. But that also would be at macro level, isn't it? Policies should be more of a... Yeah, right. Got it. Yeah, wasted, expired. Correct. How to avoid wastage. Right. Yes. Any other point? That's all. Yes, last group?
So our first point is real supplier collaboration, which is real-time data exchange within the vendors.
Okay.
Second one is supplier performance scorecard, which is rating the vendors in terms of timeline, cost of...
Yeah, in pharmaceutical or in drugs or vaccine case, how would you do that? Who would be your suppliers?
So one who supplies in the timelines based on the quality and timelines.
Yeah. No, who are your suppliers? So what are the examples in your mind? Stakeholders, are you hospitals?
Manufacturers.
Okay, manufacturers are your suppliers, right? Do you know some manufacturer's name? CMC is ordering from?
Sun Pharma.
Just give a try. Cipla. Okay, you are getting directly from Cipla or CFA agents of Cipla or distributors?
Directly.
Directly. Yeah, directly or this thing?
Good. What?
Yeah. Now, these are the supply chain issues. Please investigate now. Okay? Yeah. I'm asking this question intentionally so that, to tell you what is actually supply chain. Now you have to investigate. What is a supply chain? You are using Cipla brand, but, whether Cipla is directly supplying. Directly supplying means from their manufacturing unit, the truck is coming directly to your hospital? No. Okay?
That is own bad.
Huh?
That don't say.
They are distribution centers, right? It can be carrying forward agents, it can be distribution centers, right? So those can be, okay? So just trace that, okay? So when your deliveries are not coming on time, then the supply chain tracing and mapping helps. Like where to expedite, where to do follow-ups, okay? That's where you're good, so try to map, in the healthcare sector, okay? Then any other point? Yes.
Data-driven procurement helps in reducing overstocking and stockouts.
Yes. More real-time data, okay? Yeah, so real-time daily basis data will be your micro issue, okay? We can discuss micro measure together, okay? So daily, everyday inventory tracking will become your micro issue, okay? If you want to digitize that would become your micro issue, okay? But, certain performance indicators like how hospital is doing per month, those are your meso thing, okay?
So inventory optimization, ma'am.
Yeah.
Like ABC analysis, economic order quantity, LIFO, FIFO.
Yeah.
Based on the reordering level and stock.
Exactly. So that will be your meso, that is a decision at hospital level thinking. Other way of thinking of meso micro is our decision making duration. Whether our decision making will be for 5 to 6 months, or if it is a daily, then it is more of a micro. Okay? Yeah. Okay. Any other point? It's open. Floor is open for micro or meso. Any other point you want to give? Huh? Demand, supply, lead time, so your
That audit.
regular audits. Yeah, that will be meso. Right? That would be meso. That is something which we don't do at, the operational level or granular level. Yes.
So regarding the PET scan, like what we do in CMC, since the isotope lifetime is very less, so every day the patient go get it. The other day we schedule them next day. They have to go every day from the other state, like Bangalore somewhere, get it and get it done here.
Okay.
Since the lifetime is very less. So
okay. So this is micro. So everyday operational level, what you do is a micro.
but between the states, like since we don't have it.
Yeah. No, but you have to schedule it on daily basis, What kind of contracts you would sign with the states, that would be meso.
Okay.
Okay? Yeah. Doing it every day, reviewing it operationally every day is a micro. Right. You have a last point? Micro and... Give your point.
Ma'am, micro and meso.
Micro, meso, both.
Ma'am, insurance coverage for autoimmune illnesses, because it's a chronic condition, that is still not available. And
Very good point.
at the macro level also, in terms of awareness and policy context, government does not recognize non-apparent disability associated with such illnesses. And at the micro level, there is also employer bias to hire such candidates in having such conditions.
So the last point is more of employability of, certain set of individuals, human beings with, specific kind of medical conditions. Okay. Even I was mentioning, even neurodiversity is one of that, Though India has been doing a lot now with the, the physical disabilities, okay, maybe disability due to limb or hearing impairment or, blindness. There are many technology gadgets and, what you can say, even from employment point of view, this thing. And Even IIT Madras is one of the example. IIT Madras actually they converted all the buildings some 10, 11 years back itself. So make it accessible to all kind of I would say specially enabled people. Okay. So and things are still moving on in inclusive education. In fact, this MBA program, when we will be having a new batch, we will be having one candidate who cannot see. So now we really don't know how we will orient our whole curriculum towards that. So but we are approaching in that direction. I'm sure this is very interesting points. It has to be done at macro level, how to sensitize all the healthcare facilities to have standard procedures, timely diagnosis so that they should not. Other problems are there because this is not happening on time. If the cure will be happen on time, then employment issues will not come because people will get cured, right? So these are very interesting points. Thank you very much for that. I hope now you have seen. So why we have to study macro, meso and micro, right? Why this three categories? Why you think, we have to analyze all these three at three levels to address them accordingly, to hold accountability, okay? To have clear roles and responsibilities, for different levels, right? That's why it is very important to, so that we can strategize at each level, okay? What is the responsibility? Okay, so thank you for all that. Now, should we switch to other mode? Are you ready for Excel exercises? Okay. Okay. So, let me tell you, you can open the Excel. First of all, yesterday, whatever we have discussed, location problem, this thing, can you give me examples from healthcare sectors where we have to address facility location related problems? Some more problems. Yesterday, we discussed that, where to locate healthcare clinic. Okay, there, location problems will come. We have also discussed location, allocation, such problems are there. Can you relate with other aspects in healthcare sector?
Designating some place for ambulance parking. We have national policies. Government is distributing the certain number of ambulances to the district level. But district is a very big location geographically. And we have different demands from different villages. There are no uniform population. So this has to be...
Yeah.
Right.
So what do you think where ambulances are parked? Are they parked inside hospitals? Some might be there, but where are the designated places? Should it be parked in the hospitals only? No, right? So where it should be parked? How would you make this decision? Can you relate it with what we did yesterday?
The point, travel covered, and also the population density there. So both point we need to consider. Both the examples would...
Exactly. The time is very critical when ambulance is required. Okay. So this is also one of the example if we have to locate the facilities. Any other thing is coming, where such decisions are required to be made? Referral systems. Higher facilities. That is also very important. Okay. For example, you have gone to your GP. GP has diagnosed you have this thing, you have to go to the next level. Okay. Now, how they would refer to this thing, So sometimes, one hospital can be overcrowded, right? How to plan it, distribute it, how to allocate patients in such a way that, it would be uniformly referred. Otherwise, at one facility, there would be lot of rush, right? That can also be it can be location and allocation problems. Okay. Where other, okay, this is location problem, but where other, in general optimization problems will be there. Okay. For example, if you have to do the scheduling, how do you schedule the nurses? how rosters are defined, how doctors are scheduled, correct? How to decide which shift, how many nurses are required in this shift, and how to allocate various sections, like, for the nurses, for the doctors, okay? And how to schedule it if we have to say that schedule in such a way that every nurse will get Saturday, Sunday off, right? Sunday, Monday off. When you have to schedule it for whole hospital, big hospital, how would you do that? Okay? It's a very cumbersome process, but thanks to optimization. Okay? So we can actually do that. Okay, one example today we can do is assignment problem, right? So this the formulation which you are seeing. So generally in optimization problem, what are the ingredients here? Ingredients are, first we do the objective function. Objective function, the first thing which you are seeing is minimize, right? And some summation sign, XC, Cij, Xij. When we write these things, these things are nothing but objective function. What we want to achieve. We want to minimize it and we want to maximize it. Okay? So mostly in this objective function, there would be one unknown which we want to find out. The unknown which we want to find out is called decision variable. We want to determine this value. That means this value, if we would vary this value, our objective function would change. It's a variable. That's why this is called variable. This is decision variable. However, the Cij which you are seeing, this is mostly a constant. Okay? This is mostly a constant. Okay? So this is the first thing in any optimization problem. We must have some objective function, what we want to achieve. Okay? Then comes the constraint, subject to. Okay, why constraints? Every optimization problem we see that mostly operations research optimization, when it was launched, right? It was actually mostly it was this line of discipline was became famous during World War. After World War I, they realized that most of the resources were in shortage, ammunition in shortage, food in shortage. Even the warriors, they were not able to get the food. The ammunition was not adequate. So that led to the need for such kind of optimization problems, how to manage the resources when they are in shortage, when they are scarce. Okay, so that is reflected in the second ingredient here, that is constraints. My supply is constrained. I have to fulfill my demand. Okay, so we have to, that means we want to minimize or maximize something given that there are some constraints. Okay, something is constraining, something is scarce, something we are required to fulfill, then this comes the constraints. Okay, so we have learned objective function, decision variables, constraints, and constraints can be of different type. So some are called functional constraints, but one type of constraints are non-negativity constraints. Okay, we want to solve the problem, but we want decision variables to take values more than or equal to 0. We want them to take positive values. Okay, so this is a general structure of any optimization problem. Okay, now only things which vary is that whether are we restricting the decision variables to take continuous values. Continuous values means 0, 0.1. Can they take fractional values, or are they allowed to take only integer values, non-fractional? Because when we have to see how many nurses to allocate, we cannot have 2.5 nurse, correct? We cannot have 3.5 doctor, right? So then we want the model should give us the value in integers, right? However, if we are actually doing the food, how much food we should have, how much food we should allocate to the department, how much sugar, how much this thing, that can have continuous, isn't it? 450.6 gram, right? So that can be having continuous variable, okay? But at some times, like, we don't want continuous integers, we just want binary, whether it should be yes or no, right? So I have 5 departments, probably 5 wards. One is neonatal, another is like, maybe like, some ICU, this thing. And we have set of 5 nurses. And 5 nurses, they might be having mixed skills. Okay, mixed skills. But still, how we are going to allocate particular nurse on the ward, right? So maybe we would have some criteria, right? We can have some points. If this nurse is having more inclination or like, past proficiency is in, ICU, like maybe 50%, other nurse might also have 60%, okay? So these kind of things are there, but we don't know how to assign, okay? How to maximize that, the thing that the right proficiency is allocated to the right ward. This is called assignment problem. Here my variable will take whether to assign or not to assign. Those decision variables are called binary variables, right? 0 or 1, okay? Now we will do this interesting exercise, okay? This is an assignment problem, right? So consider the problem of assigning 4 vaccine centers to 4 hospitals in Chennai, okay? Suppose we have an issue, right? So we have to assign 4 vaccine centers to 4 hospitals in Chennai. So there are maybe due to cost. The cost of assignment is given in the table below. Find the optimal assignment that minimize the total cost. Okay. So we have to assume that probably this vaccination is of different nature. Okay. So when we would assign vaccine 1 to hospital 1, it costs 12. Okay. But when the vaccine is assigned to hospital 2, it costs 7. Probably that means maybe hospital 2 is closer to the facility which can provide vaccine 1. Okay. So similar thing is there. So this matrix of costs are available to us. Okay. Now how we can read it, this matrix, what this 12 is. Now 12 is the another ingredient in the optimization problem. What we call it parameter. Parameters are the entities which are known to us. Now you can go back last slide, Sujan. Here. Now you see Cij. You know what is Cij? Cij is the cost. Okay. Next slide. Now this matrix can be written as, this can be I, right? Vaccine is I, right? And hospital is J. Okay. Now this 12 is nothing but your Cij. If I is 1, J is 1, the first cell is C11. Okay. But now should we assign vaccine 1 to hospital 1? How we would capture that? That would be captured by X11. Can you write X11? Also, Sujan, in first cell, X1. Okay. Now, if X11 will be 1, that means we would assign vaccine 1 to hospital 1. If it would be 0, then we cannot assign. But how will we come to know? See, this is a cost structure. We don't know. Okay. And it is also like, not very, there is not much difference. It's not that one is 100 and another is 2. So that we can make decision. 100 is clear. No, because 100 is a costly affair. These are comparable, relative. How we can make decision? So what we want to do, we want to assign the vaccine to the hospital in such a way the cost of assignment is minimal. Okay, and how we can do it? We will write C11 X11 plus C12 X12 and so on till C44 X44. We will add them all and we want to minimize the cost. Okay. Now this is what we want to achieve. But what is the condition? This is an assignment model. What assignment model says that only one vaccine center should be allocated to only one hospital. If VC1 will be allocated to H1, then VC1 cannot supply to any other hospital, or we can say that no other hospital can get supply from VC1. Okay, so we don't know which assignment would be this thing, but how we can ensure that, you know, the VC1 can give to only H1. Okay, so how we can do that? Whatever VC1 can supply to H1 plus VC1 can supply to H2, X11, X12, X13, X14. All these 4 variables have to be equal to 1. Means this only 1 is permissible. Right? And this we will write for all VCs. So we will get 4 constraints for that. Right? So that is equal to 1. Okay? Condition is this variable X12 or Xij is binary. It can take only value 0 and 1. Alright? Next thing. This vaccination side we have covered. Now about what about hospital? Even hospital 1 can take supply for vaccine 1 plus hospital can take supply from vaccine 2. That means X11, X21 plus X31 plus X41. Only one assignment. Even this addition should be equal to 1. So how many more constraints we will get? 4. So now we have got 8 constraints, right? And we want to satisfy the objective function. But we have not told the model yet what should be the nature of Xij. Okay, so we will say Xij has to be 0 or 1. Right? Simple? Simple assignment problem. Okay. Now we can show the Excel, Sujan. So in the slides you can see we have finished the formulation. Everything you can see. 8 constraints, Xij is equal to 0, 1, and you can expand. Now who is finding this mathematical very difficult? Is mathematics difficult? Are you finding it difficult now? Have you understood the concept? Have you understood? Right? So X11, why don't get scared of this X term? Okay, X is it's decision variable. We don't know the value. That's why we are writing X11. After we will get the value, then you don't need to be scared of X1 or Xij. Right? So right now you can say these things which we don't know, we want to find out. Okay. Now in Excel, we will see how this Excel solver will solve the problem quickly. We can solve it manually also. In operations research, we have standard algorithms to solve this problem. We can solve it manually also, and it will ensure optimality. Means this is the best result, best optimal result. What do we mean by that? We cannot have a lower cost than the answer which we will get from this using the standard algorithms. Okay, this is called the optimal results, right? Now you see here, you can make it 0, 0, 0 all, and we will run the solver. Right, now what we have done, we have created a matrix forCijs. Like you can highlight Sujan. We have highlighted.
Already given to you as a cost matrix.
Yeah. Correct. Right. Now we will create one matrix for our decision variables. Right now, either we will put 0 in all or let it empty. Okay. Now what should be objective function? What should be objective function? Can you try? Yeah. You want to try? What should be our objective function? Like, what would go in H2 cell? Yeah, let me go there. So here is that is your C11, 12 is your C11, and this is your X11. C11, X11 plus C12, X12, keep on adding there. Okay? Ideally, we have to multiply the cells C11 with the corresponding X11. Okay? Either we will go through all the cells. It is 4 by 4, 16 cells in a matrix. Either you do that, or if both cells are symmetric and we want to multiply the corresponding cells in a symmetric matrices, we can use sum product. Sum product will do the job. You can use the function sum product. Okay, sum product will do what? Like, the C11 will be multiplied by X11 plus C12 will be multiplied by X12. Okay, so we have what? We have put the formula there. Now formula is there. Whenever our solver will optimize it, it will calculate the optimal X12 value and it will pick only Cij, which is optimal, and would give the value. Now what will go in the constraints? The left hand side. So one constraint, one set of constraints for all vaccines, and one constraint is for all hospitals, right? So that means X11 plus X12 plus X13 plus X14 have to be equal to 0, or have to be equal to 1. Very good. So with the summation formula we will put on under the left hand side. You can see here already there sum. Similarly, we will write this formulas for hospitals. That should also be equal to 1. Okay, this computation only we are doing for convenience, right? Because when we will opt for solver, okay, we will go to solver. Now solver will ask in the same definitions, objective function, constraints. Asking. So in the constraints window, we don't need to write the formula again. We will just choose the cell. Okay. Now can you go to the solver? Yeah. Now solver, you will say set objective. When we will click on the right side of arrow, it will ask, in which cell, we have written the formula of objective function. Okay. So he would select H, and then it will say by changing varying cells.
So click minimize max.
And we select we want to now minimize the cost, we will choose minimize. Now next is, what do we want to change? What is our decision variable? Changing cells. So we will choose only the decision variable cell. X11, X12. Right now they are 0. Okay. But when it will run optimally, it will tell what is the optimal solution, which one to choose. We will now, this is the decision variables. Now we have to select the constraints. So which cell? We can choose all the cells equal to 1. You can also write 1 there, or you can give the address of that cell, because we have already written on the written 1 on the cell. We can choose the cell and just okay. Okay. So are we ready for the magic? And what is the other constraints? Binary constraints, because solver doesn't know. Otherwise, solver will take it as a continuous value. Okay. Now all set. Should we do abracadabra? Okay, solve it. So this will ask the question, there is the theory behind it. If you want to keep solution, it will give lot many other things. Done? Okay, can you see whether Sujan has solved it correctly? What is assigned to what? Can you see? Yeah, can you tell which hospital is assigned vaccine 1? Huh? VC1 is assigned to which hospital? H2. VC2 is assigned H3. And VC3 is assigned to H1. And VC4 is assigned to HC4. When we will be having this assignment, we would get minimum cost. We can assign the vaccine to hospital at minimum cost with this arrangement. It's okay? Right? So can you also solve it? Right? Please everyone solve this one. So this is the objective function. We have got 26. The total cost will be 26. Right? This is a minimum cost. This is the optimal cost which we would get while assigning facilities. Okay? Yes.
Yeah. Within the 9-7 that you've given. Yeah. This figures 12, 7, 9, 7 is the distance, or is it the cost in thousand?
It is, for this example, it is the cost. Okay? If you want to minimize distance, it can be distance. If you want to minimize time, it can be time.
So, like, I got this one, but the see, if I understood it right, if we assign vaccines center 1 to hospital 1, it will cost us 12,000 rupees. And in real practice, how do we get these figures? Before even we start the program.
So that's what, probably it is the distance between them, maybe the transportation time between them, or transportation cost between them. Sometimes, one hospital is not accessible from the VC4 center. Okay? So it is very, very costly. Okay? So this is and this can be solved in variety of other problems also, assignment problems. Okay? Right. You all are comfortable with this? Okay? So should we do the next problem 3? Huh? I think it's a time is 4:30 now. So try to read problem 3. Okay? Try to relate to problem 3. We can discuss it tomorrow. Okay? Problem 2 also. Can you open problem 2 one more time? Yeah. You want Excel or you want the formulation?
Formulation I have already said. So one thing you can do.
No, their doubt is in problem or the Excel.
Which one?
Your doubt is in problem, formulation or Excel?
You got to use this constraint or
Constraint. Okay. Okay, can I write, I got it, there. Yeah, I think over break you have asked this question, right? Was in this constraint, isn't it xij less than or equal to xjj? This only, right? So, to write this constraint, you just fix first j1, right? You fix j1 and vary I. What do I mean? x11 less than x11, x21 less than x11 less than or equal to x31 less than x11, x41 less than x11, x51, x61 less than x11 less than x1. Okay? Now you fix j is equal to 2. x12 less than or equal to x. What should be equal to? 2, 2. Right? Because we have to check all the diagonal elements Okay, that if this will be selected, if this will be 1, then only this can be selected. So what? X22 less than X22, X32 less than X22, X42 less than X22, and so on. Anything will do. You can do otherwise also. But stick to this term. No, have you taken till J6? So 1, 2, 3, 4, 5, 6. 6 into 6, 36 constraints. Have you taken 36 constraints? Right? Try to do like this. You were able to solve it? This is the query, or you have any other question on that?
It does electric additive, but is the sum of
Yes. No. No. Say, listen, whatever I have explained this constraint. This one. Okay. So what left and right hand side which you are saying, that is because see, summation is only with this constraints and this constraint. We have to write all 3 constraints. First constraint xjj, it will be 6 constraints for it. There will be 6 constraints for this. And how it will look like? x11, not 6 constraints, but if we would expand, 6 terms. x11 plus x22 plus x33 plus x66 is equal to 2. We need 2 facilities. What is the next constraint? Now here xij is equal to 1. This is summation. X. Now you see here for all I. Okay. Now let's see freeze I. Okay. This is our set of first constraint. This is set of third constraint. Now what is set of 2 constraints? First for I1, correct? That's what? For all I. For I1, 1, keep varying and then sum across j. x11 plus x12 plus x13 till x16 is equal to 1. That means only one facility would be assigned, right? Now for I is equal to 2, x21 plus x22 and so on, x26 is equal to 1, and we will be having set of 6 constraints. So one constraint for this, 6 constraints, set of 6 constraints for constraint number 2 and 36 constraints for set of 36 constraint for third constraint. And what else we have? Xij has to be, we write 0 to 1 like this, or we just say it is binary. Can you try now? Right? These 2 problems you can try. Still, if you have any issue, we can discuss it tomorrow. Yeah. Yes. Or what you can do, because because we have already defined in the left hand and right hand side, we can just copy paste here. Okay. Copy paste. Yeah.
It was select author decision variables less than equal to the diagonal first diagonal.
Yeah.
This select all the variables less than equal to the second.
All variables you have to take should be less than equal to x11. All variables you will take less than or equal to x22. It will be 36 constraints. Okay?
We take the height table. Will be more than third value take now. Increase that.
Constraints will be more than 36, because 36 constraints, set of constraints are only for the third type of constraints. First type of constraint is having only one equation, one constraint. Second type of constraint has set of 6 and then 36.
They give that we have
Second is like, that
take all of stop.
for all I, yeah. So that only one facility can be assigned.
What does it mean? Sorry.
1 plus 6 plus 36, correct? And then one constraint for binary. That xij can take only binary value.
So,
Yes. Okay, can you try? Yeah, so you can please try. Still, if you have any difficulty, we will meet. Okay, can I ask one more question?